The most common site of fertilization is option A uterus, option B cervix, option C ampulla of fallopian tube, option D isthmus. The correct answer is option C ampulla of fallopian tube. Fertilization typically occurs in ampulla of the fallopian tube. It is the widest and most distal portion where the ovum capacitated sperm. The ampulla provides an environment that supports sperm egg interaction and fertilization within 12 to 24 hours after ovulation. The most common site of fertilization is normal duration of menstrual cycle is. The correct answer is option B 21 to 35 days. A normal menstrual cycle ranges 21 to 35 days in adults, average 28 days. This interval is measured from the first day of one period to the first day of the next. Cycles outside this range may be oligomenoric or polymenoric and warrant evaluation if symptomatic. The normal duration of menstrual cycle is 21 to 35 days, average 28 days. The hormone primarily responsible for ovulation is option A follicular stimulating hormone, option B luteinizing hormone, option C estrogen, option D progesterone. The correct answer is option B LH hormone. A mid-cycle luteinizing surge triggers final follicular maturation, causing follicle rupture and release of oocyte. Estrogen rise from the dominant follicle triggers the LH surge via positive feedback. FHS supports follicular growth earlier. Corpus luteum mainly secretes option A estrogen only, option B progesterone only, option C estrogen and progesterone, option D follicular stimulating hormone. The correct answer is option C estrogen and progesterone. After ovulation, the corpus luteum secretes progesterone dominant and some estrogen to prepare and maintain the endometrium for possible implantation. If pregnancy occurs, HCG supports the corpus luteum until the placenta takes over steroid production. Corpus luteum mainly secretes estrogen as first structure seen on transvaginal ultrasound to confirm early intrauterine pregnancies. Option A fetal pole, option B yolk sac, option C gestational sac, option D cardiac activity. The correct answer is option C gestational sac. The gestational sac is the earliest sonographic sign of intrauterine pregnancy at 4.5 to 5 weeks. The yolk sac appearance next 5 to 6 weeks, then fetal pole and cardiac activity at 6 weeks onwards. Transvaginal ultrasound increases sensitivity in early pregnancy. First structure seen on transvaginal ultrasound is option C gestational sac. Average duration of a normal pregnancy from last menstrual period is option A 36 weeks, option B 37 weeks, option C 40 weeks, option D 42 weeks. The correct answer is option C 40 weeks. Gestation is measured as 280 days, that is 40 weeks, from the first day of the last menstrual period. Term pregnancy is defined as 37 to 41 with the more than 42 weeks considered post-term. The placenta is formed from which tissues? Option A endometrium only, option B trophoblast and endometrium, option C myometrium, option D amnion only. The correct answer is option B trophoblast and endometrium. Placenta is a maternal fetal organ formed by fetal trophoblast, cyto and syncytial trophoblast and maternal decidua basalis, modified endometrium. It mediates nutrient and gaseous exchange, hormone production and immunologic interactions. Placenta formed from trophoblast as well as endometrium. Human chorionic gonadotrophin is secreted by option A corpus luteum, option B syncytiotrophoblast, option C cytotrophoblast only, option D endometrium. The correct answer is option B syncytiotrophoblast. The syncytiotrophoblast outer layer of trophoblast secretes HCG starting shortly after implantation. HCG maintains the corpus luteum, thus progesterone, in early pregnancy until the placenta can produce sufficient steroids. HCG is secreted. Earliest clinical sign of pregnancy is usually Option A, amenorrhea. Option B, nausea and vomiting. Option C, quickening. Option D, breast enlargement only. The correct answer is option A, amenorrhea. Amenorrhea or missed period is often the first clinical indication of pregnancy. Other early signs, nausea, breast sense changes follow, but are less specific. Confirmatory testing is beta HCG and ultrasound is needed. Earliest clinical Chadwick sign in pregnancy refers to option A, bluish discoloration of cervix and vagina. Option B, softening of cervix. Option C, enlargement of uterus. Option D, pigmentation of areola. The correct answer is option A, bluish discoloration of cervix and vagina. Chadwick sign is a cyanotic or bluish discoloration of vagina and cervix mucosa due to increased pelvic blood flow and vascular congestion seen around 6 to 8 weeks. Goodell sign is option A, softening of the cervix. Option B, bluish discoloration of cervix. Option C, fetal movements felt by mother. Option D, uterine enlargement. The correct answer is option A, softening of the cervix. Goodell sign is a softening of the cervix due to increased vascularity and edema, typically detectable around 6 weeks gestation. Goodell sign is a softening of the cervix, typically detectable around 6 weeks gestation. Hagar sign indicates option A, softening of lower uterine segment. Option B, fetal heart sound. Option C, palpable fetal parts. Option D, spontaneous fetal movements. The correct answer is option A, softening of the lower uterine segment. Hagar sign is softening of lower uterine segment between cervix and fundus, noticed around 6 to 8 weeks. It aids early pregnancy detection on bimanual examination. Hagar sign indicates softening of the lower uterine segment, noticed around. Linea nigra in pregnancy is caused by option A, increased progesterone only. Option B, increased melanocyte stimulating hormone. Option C, mechanical stretching alone. Option D, fetal hormones crossing placenta. The correct answer is option B, increased melanocyte stimulating hormone or estrogen effect. Linea nigra is a midline hyperpigmentation due to hormonal stimulation of melanocytes, estrogen, progesterone, MSH during pregnancy. It often fades postpartum. Linea nigra in pregnancy is caused by increased melanocyte stimulating hormone. Quickening first perceived fetal movement usually occurs at option A, 6 to 8 weeks. Option B, 8 to 10 weeks. Option C, at 16 to 20 weeks. Option D, at 24 to 28 weeks. The correct answer is option C, at 16 to 20 weeks. Quickening typically occurs around 18 to 20 weeks in primigravidas and slightly earlier, 16 to 18 in multigravidas, when the mother first perceives fetal movement. Fetal heart sounds are first heard by Doppler at approximately option A, 6 to 8 weeks. Option B, 10 to 12 weeks. Option C, 16 to 18 weeks. Option D, 20 to 22 weeks. The correct answer is option B, 10 to 12 weeks. A Doppler device can often detect fetal heart tones around 10 to 12 weeks. A handheld fetoscope typically hears them later, 18 to 20 weeks. Fetal heart sounds are first heard by Doppler at approximately 10 to 12 weeks. Average recommended maternal weight gain in a normal VMI pregnancy is about option A, 5 to 8 kg. Option B, 11 to 13 kg. Option C, 15 to 20 kg. Option D, 25 to 30 kg. The correct answer is option B, 11 to 13 kg. For women with normal pregnancy BMI, recommended total weight gain is 11 to 13 kg, that is 25 to 35 lb in other guidelines. Individualized targets vary by BMI. Normal definition of anemia in pregnancy. Option A, HV less than 10 grams per deciliter. Option B, HB less than 11 grams per deciliter. Option C, HB less than 12 grams per deciliter. Option D, HB less than 30 grams per deciliter. The correct answer is option B, HB less than 11 grams per deciliter. Anemia in pregnancy is defined as hemoglobin less than 11 grams per deciliter in first and third trimesters and less than 10.5 grams per deciliter in second trimester according to WHO or commonly used criteria. Most common direct cause of maternal death worldwide, especially in low resource settings. Option A, infection. Option B, hypertensive disorders. Option C, hemorrhage. Option D, embolism. The correct answer is option C, option C, hemorrhage. Postpartum hemorrhage, largely from uterine atony, retained placenta, or trauma, remains the leading cause of maternal mortality globally, especially where access to emergency obstetric care is limited. Common cause of maternal death is worldwide hemorrhage. Classic trait of preeclampsia includes option A, hypertension, proteinuria, edema. Option B, fever, hypertension, convulsions. Option C, proteinuria, hyperglycemia, anemia. Option D, hypertension, bleeding, edema. The correct answer is option A, hypertension, proteinuria, edema. Preeclampsia is characterized by new hypertension after 20 weeks plus either proteinuria or end organ dysfunction. Edema is commonly seen though not diagnostic alone. Preeclampsia is characterized by eclampsia is defined as preeclampsia with option A, visual disturbances. Option B, loss of conscious only. Option C, seizures, convulsions not attributed to other causes. Option D, fever and headache. The correct answer is option C, seizures not attributed to other causes. Eclampsia, onset of generalized tonic-clonic seizures in a woman with preeclampsia, not attributable to other neurological conditions. Best simple clinical measure to assess growth in pregnancy is best simple clinical measure to assess fetal growth in pregnancies. Option A, serious ultrasound only. Option B, fundal height measurement, symphosio fundal height. Option C, maternal weight only. Option D, fetal heart rate monitoring. The correct answer is option B, fundal height measured from symphysis pubis to fundus in centimeters, roughly approximate gestational age after 20 weeks. It is a simple, cost-effective screening for fetal growth and amniotic fluid issues. Normal amniotic fluid volume at a term is approximately option A, 200 to 400 ml. Option B, 400 to 800 ml. Option C, 800 to 1200 ml. Option D, 1500 to 2000 ml. The correct answer is option C, 800 to 1200 ml. Normal amniotic fluid at term is roughly 800 to 1200 ml. Assessment by amniotic fluid index or single deepest pocket helps diagnose oligohydramnios or polyhydramnios. Normal amniotic fluid volume at term approximately 800 to 1200 milliliters. Polyhydramnios is often defined by an AFI amniotic fluid index more than option A 12 centimeters, option B 18 centimeters, option C 24 centimeters, option D 30 centimeters. The correct answer is option C 24 centimeter. Polyhydramnios is commonly defined as AFI more than 24 centimeters or single deepest pocket more than 8 centimeters. Causes include fetal anomalies, esophageal atresia, maternal diabetes, multiple pregnancy. Polyhydramnios is often defined by AFI more than 24 centimeters. Oligohydramnios is defined by AFI less than option A 10 centimeter, option B 8 centimeters, option C 5 centimeter, option D 2 centimeter. The correct answer is option C 5 centimeter. Oligohydramnios is typically AFI less than 5 centimeter or single deepest pocket less than 2 centimeter associated with renal agenesis, PROM, placental insufficiency, and fetal compromise. Oligohydramnios is defined AFI less than 5 centimeters. Placenta previa refers to option A placenta implanted in the this? Option B, placenta implanted in the lower uterine segment partially or completely covering the cervical os. Option C, placenta adhesion to myometrium. Option D, placenta that detaches prematurely. The correct answer is option B. Placenta previa is a placenta implantation low in uterus, over or near internal cervical os, causing painless antepartum bleeding. Managed by careful monitoring and cesarean delivery if persistent or complete. Abruptio placenta means option A, placenta implanted over the cervix. Option B, premature separation of normal sighted placenta from the uterine wall. Option C, placenta with excessive calcification. Option D, placenta encasing encashing fetal parts. The correct answer is option B. Placental abruption is premature separation of normally implanted placenta, often painful with uterine tenderness and bleeding. May be concealed. Risk factors include hypertension, trauma, smoking. Most common cause of primary postpartum hemorrhage is option A, retained placenta. Option B, uterine atony. Option C, lacerations. Option D, coagulation disorder. The correct answer is option B, uterine atony. Uterine atony, failure of uterus to contract effectively after delivery, is the commonest cause of postpartum hemorrhage, responsible for significant maternal morbidity and mortality if not promptly managed. First line uterotonic drug for postpartum hemorrhage management is option A, methyl ergometrin or ergometrin. Option B, oxytocin, IV or IM. Option C, misoprostol only. Option D, ergonovin. The correct answer is option B, oxytocin. Oxytocin is the first line uterotonic for prevention treatment of PPH due to uterine atony. Given IV or IM, other agents, ergometrin, misoprostol, carbamazepine, are adjuvants depending on the situation and contraindications. Retained placenta is diagnosed when placenta is not delivered within option A 10 minutes, option B 20 minutes, option C 30 minutes, option D 60 minutes. The correct answer is option C 30 minutes. Placenta is considered retained if not delivered within 30 minutes after birth. Some guidelines uses 30 to 60 minutes. Manual removal under anesthesia is required. Retained placenta is diagnosed when placenta is not delivered within 30 minutes. Lochia serosa usually occurs during postpartum days. Option A 1 to 3 days, option B 4 to 10 days, option C 10 to 21 days, option D 21 to 28 days. The correct answer is option B 4 to 10 days. Lochia serosa is a pink brownish discharge occurring around 4 to 10th day after initial rubra. Lochia alba follows, gradually decreasing over weeks postpartum. Lochia serosa usually occurs during postpartum days 4 to 10 days. Lochia alba typically appears after option A day 1 to 3, option B day 4 to 10, option C day 10 to 21, option D day 30 to 40. The correct answer is option C day 10 to 21. Lochia alba, whitish or yellow in color, is largely leukocyte rich and serous, usually seen 10 to 21 days postpartum as uterine involution continues. Lochia alba typically appears after 10 to 21 days. Uterus generally returns to near non-pregnant size by option A 2 weeks, option B 6 weeks, option C 3 months, option D at 6 months. The correct answer is option B at 6 weeks. Uterine involution is usually complete by 6 weeks postpartum with the fundal height descending back into pelvis and endometrial regeneration. Uterine returns to near non-pregnant state size by option B at 6 weeks. Most common site for ectopic pregnancy is option A ample of fallopian tube, option B isthmus of tube, option C ovary, option D cervix. The correct answer is option A ample of fallopian tube. The ampullary portion of the fallopian tube is the commonest site, that is approximately 70% for tubal ectopic pregnancy due to slow transport or altered tubal environment. Most common site for ectopic pregnancy is option A, fallopian tube due to slow transport or altered tubal environment. Methotrexate therapy for ectopic pregnancy is indicated in option A, all ruptured ectopics, option B, unruptured small ectopic with stable patient and low HCG, option C, heterotopic pregnancy only, option D, tubal pregnancy with hemodynamic instability. The correct answer is option B, unruptured small ectopic with stable patient and low HCG. Methotrexate, single or multi-dose, is suitable for hemodynamically stable patients with a small unruptured ectopic, absent fetal cardiac activity, and low declining beta HCG. Ruptured ectopic needs surgery. Most common ovarian tumor in reproductive age women is option A, dermoid, mature cystic teratoma, option B, mucinous cystadenoma, option C, serous cystadenoma, option D, fibroma. The correct answer is option A, dermoid, mature cystic teratoma. Mature cystic teratoma, dermoid, is a common benign germ cell tumor in reproductive age women and is frequently encountered. It may cause torsion. Most common ovarian tumor in reproductive age women is dermoid. Hadatiform mole on ultrasound typically shows option A, single fetus with heart activity, option B, snowstorm or cluster of grapes appearance without fetal parts, complete mole, option C, localized echogenic mass within placenta only, option D, polyhydramnios only. The correct answer is option B, snowstorm or cluster of grapes appearance without fetal parts. Complete molar pregnancy shows diffuse echogenic mass with multiple small cystic spaces, snowstorm, and no fetus. Partial mole may have abnormal. Complete mole is characterized by option A, triploid karyotype with fetal tissue, option B, diploid paternal only chromosomes and no fetal tissue, option C, normal fetal development, option D, chromosomal mosaicism in placenta. The correct answer is option B, diploid paternal only chromosomes and no fetal tissue. Complete mole is usually with 46 chromosomes, parental origin, no fetus, and markedly elevated HCC due to proliferation of trophoblastic tissue. Complete mole is characterized by diploid paternal only chromosomes and no fetal tissue. Partial mole features include option A, no fetal tissue, very high human chorionic gonadotrophin, option B, presence of malformed fetus, often triploid with 69 XSY chromosomes or 69 triplex chromosomes, normal placenta and fetus, option D, always progresses to choriocarcinoma. The correct answer is option D. A partial mole result from fertilization of an egg by two sperm or diploid sperm producing triploidy may have some fetal tissue, abnormal fetus, and less markedly raised HCG. A major malignant complication of molar pregnancy is option A, choriocarcinoma, gestational trophoblastic neoplasia, option B, endometrial carcinoma, option C, ovarian cancer, option D, uterine sarcoma. The correct answer is option A, choriocarcinoma. Persistent trophoblastic disease may progress to choriocarcinoma, an aggressive malignancy that is highly sensitive to chemotherapy if detected early. A major malignant complication of molar pregnancy is choriocarcinoma, gestational trophoblastic neoplasia. Primary management for hydatiform mole is option A, hysterectomy for all cases, option B, suction evacuation followed by serial beta HCG monitoring, option C, expected management only, option D, immediate chemotherapy in all cases. The correct answer is option B, suction evacuation followed by serial beta HCG monitoring. Is primary treatment serial beta HCG monitoring ensures regression and detects persistent trophoblastic disease requiring chemotherapy. Suction evacuation is a primary treatment. Bishop score is used to assess option A, fetal lung maturity, option B, cervical readiness for induction of labor, option C, pelvic adequacy for vaginal delivery, option D, degree of preeclampsia. Bishop score is used to assess. The correct answer is option B, cervical readiness for induction of labor. The Bishop score, dilation, effacement, station, consistency, position, quantifies cervical favorability for induction. Higher scores predict successful induction. Bishop score is used to assess cervical readiness for induction of labor. Most common presentation for labor is option A, breech presentation, option B, cephalic vertex presentation, option C, shoulder presentation, option D, face presentation. The correct answer is option B, cephalic vertex presentation. Vertex cephalic presentation, the fetal head is down and is the most common favorable presentation for vaginal delivery. Most common presentation for labor is cephalic vertex presentation. Favorable presentation for vaginal delivery. The fetal head is down. Correct sequence of cardinal movements of labor mechanism of normal vaginal birth. Option A, engagement, descent, flexion, internal rotation, extension, external rotation, expulsion. Option B, descent, extension, rotations, flexion, expulsion. Option C, engagement, extension, external rotation, descent, expulsion. Option D, flexion, engagement, extension, descent, expulsion. The correct answer is option A. Engagement, descent, flexion, internal rotation, extension, external rotation, expulsion. Average duration of first stage of labor in primigravida, latent plus active. The correct answer option A 4 hours, option B 6 hours, option C 8 to 12 hours, option D 18 to 24 hours. The correct answer is option C 8 to 12 hours. In primigravidas, the first stage from onset of true labor to full cervical dilation typically lasts 8 to 12 hours. Latent phase may be longer and varies widely. The average duration of first stage of labor in primigravida, latent plus active is 8 to 12 hours. Typical duration of the second stage of labor in primigravida is option A 10 to 20 minutes, option B 20 to 40 minutes, option C 30 to 60 minutes, option D more than 2 hours always. The correct answer is option C 30 to 60 minutes. The second full dilation to delivery in primigravidas often lasts 30 to 60 minutes, though prolonged second stage may be require intervention if maternal or fetal compromise occurs. Typical duration of second stage of labor in primigravida is option C 30 to 60 minutes. Active management of third stage of labor commonly includes option A immediate contraction without uterotonics, option B oxytocin administration and controlled contraction, option C no intervention unless hemorrhage occurs, option D manual removal of placenta routinely. The correct answer is option B oxygen administration and controlled contraction. Active management, prophylactic oxytocin, controlled contraction, uterine massage reduces risk of BPH by facilitating placenta delivery and uterine contraction. Active management of third stage of labor commonly include normal fetal heart rate in utero is option A 60 to 90 beats per minute, option B 90 to 120 beats per minute, option C 110 to 160 beats per minute, option D 160 to 200 beats per minute. The correct answer is option C 110 to 160 beats per minute. Baseline fetal heart rate normally ranges 110 to 160 beats per minute. Persistent bradycardia less than 110 beats per minute or tachycardia more than 160 beats per minute require evaluation for fetal compromise or infection. Normal fetal heart rate in fetal distress is commonly signaled by option A fetal heart rate of 130 beats per minute only, option B late decelerations, persistent bradycardia or recurrent variable decelerations, option C accelerations in fetal heart rate, option D maternal fever only. The correct answer is option B. Late decelerations indicate uteroplacental insufficiency. Persistent bradycardia or repetitive severe variable decelerations indicate fetal distress, warranting urgent action. Meconium stained amniotic fluid is common, most commonly associated with option A maternal dehydration only, option B fetal hypoxia or stress and postpartum pregnancy, postpartum pregnancy, Option C, normal early labor always. Option D, maternal hypertension only. The correct answer is option B, fetal hypoxia or stress and postpartum pregnancy. Meconium passage in utero occurs with the fetal maturity or fetal stress or hypoxia. Thick meconium raises concern for aspiration and needs neonatal preparedness. Apgar score assess newborn at 1 and 5 minutes using option A, birth weight and length only. Option B, appearance, pulse, grimace, activity, respiration. Option C, respiratory effect only. Option D, umbilical cord pH and glucose. The correct answer is option B. Apgar components, appearance, pulse, grimace, activity, respiration. Each score 0 to 2. Total assesses immediate newborn adaptation and need for resuscitation. Apgar score assess newborn at 1 and 5 minutes. Normal Apgar score is considered. Option A 0 to 3, option B 4 to 6, option C 7 to 10, option D 10 to 12. The correct answer is option C 7 to 10. Apgar score 7 to 10 at 1 and 5 minutes typically indicates good newborn adaptation. Scores less than 7 may need resuscitation and close monitoring. A normal Apgar score is considered 7 to 10 at 1 and 5 minutes. Typically indicates good newborn adaptation. Score less than 7 may need resuscitation and close monitoring. Postpartum blues commonly present within option A 1 to 2 days and resolve within 2 weeks. Option B immediately at delivery and persist more than 6 months. Option C before 20 weeks gestation. Option D only after 1 year postpartum. The correct answer is option A 1 to 2 days and resolve within 2 weeks. Postpartum blues appear within a few days postpartum delivery and resolve within 2 weeks. Longer, severe symptoms suggest postpartum depression requiring intervention. Puerperal sepsis refers to infection of the genital tract occurring. Option A during pregnancy only. Option B from onset of labor to 42 days postpartum. Option C only after cesarean sections. Option D only after vaginal deliveries. The correct answer is option B from onset of labor to 42 days postpartum. Puerperal sepsis is infection between labor onset and 42 days postpartum involving genital tract, often polymicrobial and requiring antibiotics and supportive care. Which contraceptive is considered safe during lactation? Option A combined oral contraceptive pill, estrogen plus progestin immediately postpartum. Option B progestin only pill, mini pill or progestin implants. Option C estrogen only pill. Option D high dose estrogen pill. The correct answer is option B progestin only pill or progestin implants. Progestin only method, mini pill, injectable implants are preferred for breastfeeding mothers. Estrogen may decrease milk supply, so combined methods are usually preferred until lactation established. Copper intrauterine device primarily contraceptive action is option A preventing ovulation only, option B creating an intrauterine inflammatory response toxic to sperm and ova, preventing fertilization. Option C blocking fallopian tubes physically. Option D endometrial atrophy only. The correct answer is option B creating an intrauterine inflammatory response toxic to sperm and ova, preventing fertilization. Copper intrauterine devices induce a local sterile inflammatory reaction that impairs sperm motility and viability and prevents fertilization. A commonly available copper intrauterine device effective for up to option A 1 year, option B 3 years, option C 5 to 10 years depending on type, copper T up to 10 years. Option D 20 years. The correct answer is option C 5 to 10 years depending on type. Depending on the type, copper T intrauterine devices are effective up to 10 years. Specific device labeling guides exact duration 5 to 10 years. Emergency contraception commonly used is option A levonorgestrel 1.5 mg single dose or split doses within 72 hours. Option B copper intrauterine device only if inserted after 5 days. Option C high dose estrogen only after 5 days. Option D prolonged antibiotics. The correct answer is option A, levonorgestrel 1.5 mg single dose or split doses within 72 hours. Is widely used as emergency contraceptive within 72 hours. Copper IUD insertion up to 5 days can also be used. Medical Termination of Pregnancy Act in India was enacted in option A, in the year of 1950, option B, in 1971, option C, 1995, option D, 2010. The correct answer is option B, 1971. The MTP Act 1971 legalized abortion under specified conditions in India. Subsequent amendments have modified gestational limits and provider requirements. Medical Termination of Pregnancy Act in India was enacted in option B, 1971. Up to which gestational age was MTP classically allowed under original act, now updated in amendments for special cases? Option A, 12 weeks only. Option B, 20 weeks. Originally 20 weeks. Amendments allow longer in specified circumstances. Option C, 30 weeks. Option D, at 36 weeks. The correct answer is option B. Originally, MTP was permitted up to 20 weeks under certain conditions. Subsequent legal and guideline changes in some jurisdictions extended limits for special cases. Always check current local law and regulations. Most common cause of secondary amenorrhea worldwide is option A, pregnancy. Option B, thyroid disease. Option C, hyperprolactinemia. Option D, endometrial carcinoma. The correct answer is option A, pregnancy. Pregnancy is the most frequent cause of secondary amenorrhea, absence of menses in women who previously had regular cycles. Pregnancy should always be excluded first. Most common cause of secondary amenorrhea worldwide is option A, pregnancy. Primary amenorrhea with normal breast development but absent uterus suggests option A, androgen insensitivity syndrome. Option B, Turner syndrome. Option C, Mullerian agencies with normal ovaries. Option D, hypogonadotrophic hypogonadism. The correct answer is option C, Mullerian agenesis. In Mullerian agenesis, ovaries function breast development normal due to estrogen, but uterus vagina are absent. Patients present with primary amenorrhea and normal secondary sexual characteristics. Primary amenorrhea with absent breast and absent uterus usually indicates option A, androgen insensitivity. Option B, Turner syndrome. Option C, primary gonadal failure. Example, gonadal dysgenesis. Option D, normal variant. The correct answer is option C, primary gonadal failure. Lack of breast development suggests ovarian failure or hypogonadism in Turner syndrome. There is streak gonads and primary amenorrhea with a lack of secondary sexual development. Dysmenorrhea means option A, heavy menstrual cycle. Option B, painful menstruation. Option C, absence of menstruation. Option D, irregular bleeding between cycles. The correct answer is option B, painful menstruation. Dysmenorrhea is painful menstruation cramp. Primarily, dysmenorrhea has no pelvic pathology, prostaglandin mediated, while secondary has underlying causes like endometriosis, fibroids. Dysmenorrhea means painful menstruation. Menorrhagia refers to option A, painful periods only. Option B, excessive menstrual blood loss more than 80 ml per cycle or clinical heavy bleeding. Option C, absence of periods. Option D, regular spotting only. The correct answer is option B, excessive menstrual blood loss more than 80 ml per cycle or clinically heavy bleeding. Menorrhagia is abnormally heavy or prolonged menstrual bleeding that is more than 80 ml per cycle clinically, leading to anemia and requiring evaluation testing for causes. Menorrhagia refers to excessive menstrual blood loss that is more than 80 ml. Polymenorrhea indicates option A, cycles longer than 35 days. Option B, cycles shorter than 21 days. Option C, no bleeding for more than 6 months. Option D, normal cycle. The correct answer is option B, cycles shorter than 21 days. Polymenorrhea denotes shorter intermenstrual intervals, frequent menses, commonly Cycle length less than 21 days, often due to anovulation or endocrine disorders. Polymenorrhea indicates cycle shorter than 21 days. Most common cause of female infertility overall is option A tubal blockage, option B anovulation, often due to PCOS, option C cervical factor, option D endometriosis. The correct answer is option B anovulation, often due to PCOS, polycystic ovarian syndrome. Anovulation frequently from PCOS is leading cause of subfertility because ovulation is required for conception. Tubal factors are also common depending on population. Best single blood test to confirm ovulation retrospectively is option A serum FSH on day 3, option B serum progesterone in luteal around day 21, option C serum estrogen on day 14, option D serum LH surge test only. The correct answer is option B serum progesterone in luteal around day 1. Mid luteal serum progesterone day 21 in 28-day cycle more than 3 to 5 ng per ml indicates recent ovulation. Higher levels more than 10 ng per ml more convincingly confirm ovulation. Polycystic ovarian syndrome commonly present with option A oligomenorrhea, obesity, hirsutism, and polycystic ovaries on ultrasound. Option B heavy regular menses and infertility. Option C active pelvic pain only. Option D post menopausal bleeding. The correct answer is option A. PCOS results with menstrual irregularities, that is oligo or anovulation. Hyperandrogenic signs, hirsutism, metabolic issues like insulin resistant or obesity, and polycystic ovarian morphology. First line drug for ovulation induction in PCOS for many patients is option A letrozole or clomiphene citrate historically, option B progesterone only, option C danazole, option D combination oral contraceptives only. The correct answer is option A. Letrozole has become first line in many guidelines due to improved ovulation and live birth rates. Clomiphene citrate has long been used historically. Choice individualized. Average age of natural menopause is about option A 40 years, option B 45 years, option C 50 years, option D 60 years. The correct answer is option C 60 years. 50 years. Natural menopause typically occurs around 50 to 51 years with variation by genetics, smoking status, and other factors. Menopause is defined as 12 months amenorrhea. Average age of natural menopause is about option C 50 years. It is defined as 12 months amenorrhea. Postmenopausal bleeding should always prompt evaluation for option A pregnancy only, option B benign polyps only, option C endometrial carcinoma until proven otherwise, option D normal variation. The correct answer is option C. Postmenopausal bleeding is a alarm symptom for endometrial carcinoma and requires endometrial sampling or ultrasound to rule out malignancy. Postmenopausal bleeding should always prompt evaluation for endometrial carcinoma until proven otherwise. The most common gynecological malignancy worldwide. Incidence in developed countries is option A cervical cancer globally, option B endometrial uterine carcinoma common in developed countries, option C ovarian cancer only, option D vulvar carcinoma. The correct answer is option B. Endometrial carcinoma is common in developed countries linked to obesity and opposed estrogen. Worldwide patterns vary. Cervical cancer remains common in low resource settings. Screening test for cervical cancer historically is option A HPV DNA test only, option B pap smear cytology, option C endometrial biopsy, option D pelvic ultrasound. The correct answer is option B pap smear cytology. Pap smear test has been the mainstay screening method for cervical cytological abnormalities. Now, HPV DNA testing is increasingly used either alone or with cytology for primary screening. Screening test for cervical cancer historically is option B. Pap smear. Most common histological type of cervical cancer is option A. Adenocarcinoma, option B. Squamous cell carcinoma, option C. Small cell carcinoma, option D. Sarcoma. The correct answer is option B. Squamous cell carcinoma. Squamous cell carcinoma is the predominant histologic type of invasive cervical cancer arising from the transformation zone. Adenocarcinoma incidence has risen with HPV and other factors. Most common histological type of cervical cancer is option B. Squamous cell carcinoma. Which HPV types are most strongly associated with cervical cancer risk? Option A. HPV 6 and 11. Option B. HPV 16 and 18. Option C. HPV 13, 1 and 33 only. Option D. HPV 1, 2. The correct answer is option B. HPV 16 and 18 are high risk genotypes causing the majority of cervical cancers. HPV 6 and 11 are low risk types causing genital warts. HPV 16 and 18. HPV vaccination is recommended ideally starting at which age group? Option A 0 to 5 years, option B at 9 to 14 years, early adolescence, option C 30 to 40 years only, option D after 50 years only. The correct answer is option B 19 to 14 years, early adolescence. HPV vaccination is recommended for pre-adolescence or adolescence before exposure with catch-up dosing up to age limits per guidelines. Vaccination reduces risk of cervical precancers. HPV vaccination is recommended ideally starting at pre-adolescent stage. Major risk factor for endometrial carcinoma include option A obesity, unopposed estrogen, nulliparity, late menopause. Option B smoking and low BMI only. Option C prior pelvic radiation only. Option D teenage pregnancies only. The correct answer is option A. Estrogen exposure, unopposed obesity, nulliparity, late menopause, PCOS, and tamoxifen use increase endometrial carcinoma risk due to prolonged endometrial. Ovarian cancer tumor marker commonly used clinically is option A AFP only, option B CA125, option C beta HCG only, option D CEA only. The correct answer is option B. CA125 is a tumor marker elevated in many epithelial ovarian cancer. It has limited sensitivity in early disease and is more useful for monitoring treatment or reoccurrence. The ovarian cancer tumor marker commonly used clinically is option B CA125. Which gynecologic cancer has the highest case fatality due to late presentation? Option A cervical cancer, option B endometrial cancer, option C ovarian cancer, option D vulvar cancer. The correct answer is option C ovarian cancer. Ovarian cancer often presents late with vague symptoms and lacks effective early screening for the general population, leading to higher mortality. Most common site of endometriosis is option A ovary, option B urinary bladder only, option C small bowel only, option D uterine serosa only. The correct answer is option A ovary, forming endometrioma or chocolate cyst. Ovaries are frequently affected by endometriosis with formation of endometriotic cyst, chocolate cyst, and causing chronic pelvic pain and infertility. Most common site for endometriosis is option A ovary. Pelvic inflammatory disease is most commonly caused by which pathogen initially? Option A E. coli, option B chlamydia, trachomatis and Neisseria gonorrhoeae, option C Candida albicans, option D HPV. The correct answer is option B. Chlamydia, trachomatis, and Neisseria gonorrhea are frequent causes of PID. The infection can ascend, causing endometriosis, salpingitis, tubo-ovarian abscess, and infertility. First line treatment for bacterial vaginosis is option A, fluconazole, option B, metronidazole, oral or topical, option C, azithromycin, option D, clotrimazole, vaginal pessary only. The correct answer is option B, metronidazole, oral or topical. Metronidazole, oral or topic or intravaginal, is the standard treatment for bacterial vaginosis. Tinidazole is another alternative. First line treatment for bacterial vaginosis is metronidazole, oral or trichomonas vaginalis infection typically causes. Option A, thick white curdy discharge without odor. Option B, frothy yellow green discharge with pungent odor and strawberry cervix on exam. Option C, bloody discharge only. Option D, no discharge ever. The correct answer is option B, frothy yellow discharge with pungent odor and strawberry cervix on exam. Trichomoniasis often produces frothy greenish foul smelling discharge with vulvovaginal irritation and may show punctate hemorrhages on the cervix. Vaginal candidiasis usually presents with option A, green frothy discharge, option B, thick white curd-like discharge with intense pruritus and normal pH, option C, profuse water discharge only, option D, painful ulcers only. The correct answer is option B, thick white curd-like discharge with intense pruritus and normal pH. Candida albicans cause thick white cottage cheese discharge marked vulval itching and typically normal vaginal pH. Microscopy shows pseudohypae. Vaginal pH in candidiasis is option A, less than 4.5, option B, more than 6.0, option C, more than 7.0, option D, 5.5 to 6.5. The correct answer is option A, less than 4.5. Candidiasis usually maintains normal vaginal pH less than 4.5, and trichomoniasis arise pH more than 4.5. Vaginal pH more than 4.5 suggests which infection? Option A, candidiasis. Option B, bacterial vaginosis or trichomoniasis. Option C, normal flora always. Option D, HPV infection only. The correct answer is option B. Elevated vaginal pH more than 4.5 suggests bacterial vaginosis or trichomoniasis. Testing and targeted therapy recommended. A Bartholin cyst results from option A, malignancy of Bartholin gland. Option B, obstruction of Bartholin gland duct leading to cyst or abscess formation. Option C, HPV infection only. Option D, endometriosis of labia majora. The correct answer is option D. Bartholin duct gland duct obstruction leads to cyst formation. Superinfection can produce painful Bartholin abscess. Management depends on size, symptoms, and patient age. Uterine fibroid leiomyoma is tumor of option A, endometrial glandular tissue. Option B, smooth muscle of uterus myometrium. Option C, ovarian stroma only. Option D, cervical epithelium. The correct answer is option B, smooth muscle of uterus. Leiomyomas are benign tumors of uterine smooth muscle cells, myometrium, and common in reproductive age women causing menorrhagia, bulk symptoms, infertility. Uterine fiber is a tumor of smooth muscle of uterus. Red degeneration of fibroid is classically associated with option A, post-menopausal women only. Option B, pregnancy, common in pregnancy due to vascular compromise. Option C, always malignant transformation. Option D, menopause regression only. The correct answer is option B, pregnancy, common in pregnancy due to vascular compromise. Red degeneration Hemorrhagic infraction of fibroid often occurs during pregnancy due to rapid growth and outstripping blood supply, presenting with acute pain and low-grade fever. Red degeneration of fibroid is classically associated with common clinical symptom of uterine fibroid is option A, amenorrhea only, option B, menorrhagia, heavy bleeding, pelvic pressure, bulk symptoms and infertility, option C, painful sexual intercourse only, option D, always asymptomatic. The correct answer is option B, menorrhagia. Fibroids commonly cause heavy bleeding, menstrual bleeding, pelvic pressure, urinary frequency, and sometimes infertility depending upon size and location. Common clinical symptom of uterine fibroid is heavy bleeding. Or best initial investigation for suspected uterine fibroid is option A, MRI pelvic always first line, option B, transvaginal or transabdominal ultrasound, pelvic ultrasound, option C, CT scan of abdomen only, option D, hysterosalpingography only. The correct answer is option B, transvaginal or transabdominal ultrasound, that is pelvic ultrasound. Pelvic ultrasound, transvaginal or transabdominal, is a first-line accessible and effective to identify and map fibroids. MRI may be used for surgical planning or complex cases. Initial investigation. Small asymptomatic fibroids in women desiring fertility are best managed by option A, immediate hysterectomy, option B, conservative management, option C, oophorectomy, option D, radiation therapy. The correct answer is option B, conservative management. Observation. Observation is appropriate for small asymptomatic fibroids, especially when fertility preservation is desired. Treat only if symptomatic or causing infertility depending upon location. Endometriosis commonly presents with which symptoms? Option A, dysmenorrhea, dyspareunia, chronic pelvic pain and infertility. Option B, asymptomatic always. Option C, only abnormal uterine bleeding in postmenopausal women. Option D, only urinary symptoms. The correct answer is option A. Endometriosis causes cyclic pelvic pain, deep dyspareunia, and is associated with infertility because of adhesions and inflammatory environment. Endometriosis commonly present with dysmenorrhea, dyspareunia, chronic pelvic pain and infertility. Adenomyosis means option A, endometrial tissue outside uterus on ovaries only. Option B, presence of endometrial tissue within myometrium, uterine muscle. Option C, malignant invasion of myometrium. Option D, a type of fibroid. The correct answer is option B, presence of endometrial tissue within myometrium, uterine muscle. Adenomyosis is endometrial gland and stroma present within the myometrium, causing a diffusely enlarged tender uterus and heavy, painful menses in multiparous women. The most common benign ovarian tumor epithelial is option A, serous cystadenoma, option B, Brenner tumor, option D, dysgerminoma, option D, steroid cell tumor. The correct answer is option A, serous cystadenoma. Among epithelial ovarian tumors, serous cystadenoma is common. Epithelial tumor overall constitute a large proportion of ovarian neoplasm. Krukenberg tumor refers to option A, primary ovarian mucinous tumor only. Option B, metastatic tumor to ovary classically from gastric carcinoma. Option C, primary ovarian germ cell tumor. Option D, benign ovarian fibroma. The correct answer is option B. Krukenberg tumor is a secondary ovarian metastasis, usually from gastric carcinoma, histologically showing signet ring mucin secreting cells. Vulvar carcinoma is commonly associated with which HPV types? Option A, HPV 6 and 11 only. Option B, high risk HPV types like 16, 18, 31 in many cases. Lesion sclerosis in others. Option C, always not HPV related. Option D, HPV type 1 only. The correct answer is option B, some. Vulvar squamous cell carcinomas are HPV related 16-18-31. Others arise in older women associated with chronic dermatosis like Lichen sclerosus and or HPV independent. Female pseudohermaphroditism is most commonly due to option A androgen insensitivity syndrome, option B congenital adrenal hyperplasia leading to excess androgen production, option C Turner syndrome, option D Klinefelter syndrome. The correct answer is option B congenital adrenal hyperplasia. Most common site for primary vaginal carcinoma is option A upper posterior one third of vagina near cervix, option B lower anterior one third only, option C vaginal never gets cancer, option D clitoris only. The correct answer is option A upper posterior one third of vagina near cervix. Primary vaginal carcinoma commonly occurs in upper posterior third of the vagina, often contagious with cervical pathology. It is relatively rare overall. Most common setup. Best laboratory test to confirm that ovulation occurred in a cycle. Option A serum LH measurement on day 3. Option B luteal phase serum progesterone assay. Option C transvaginal ultrasound on day 2 only. Option D urinary estrogen measurements. The correct answer is option B. Mid luteal serum progesterone is the best single blood test to confirm that ovulation occurred, with values more than 3 to 5 Ng per ml indicating luteal activity. Timing related to cycle length must be considered. Thank you.